Hello, everyone. My name is Maribel Rodriguez. Welcome back to Living Well with Diabetes. Again, empowering a self managed lifestyle. And so this is going to be week 3. All right. Week 3, being active. And so let's go ahead and ask ourselves these questions at home. What do you want to learn today about being physically active? What is your greatest concern about engaging in more physical activity? What is the best part about being physically active for you? So go ahead, take a moment, pause the video, reflect on these questions, and ask yourself these at home. Moving on, diabetes and physical activity. We're going to have a couple slides over this. And so, physical activity can improve blood sugar levels by helping use insulin better. There are special proteins in our muscles called GLUT4 that help bring glucose into the muscle cells. When we exercise, these proteins move to the surface of the muscle cells to collect more glucose and give our muscles the energy they need to keep moving. Even after we stop exercising, these proteins keep working to bring glucose into the muscle cells for a little while. Blood sugar levels can improve for about 2 to 72 hours, depending on the type of aerobic activity. So, if we do a more intense aerobic activity for a longer time, we're going to see longer hours up to the 72. If we're doing a lower aerobic activity at a less intensity, we're going to see probably around those 2 or so hours. So, being regularly active helps strengthen the heart, improves blood lipids, and lowers the risk of heart disease. And this is like what we talked about last week in the week 2 with reducing risks. And so, physical activity can help with weight loss and lower body fat levels, particularly fat around the middle and inside the belly, also known as visceral or deep fat. This is important to note because it's highly associated with insulin resistance and greater risk for heart disease. So, like again, I mentioned, we talked about this last week and what that looks like. And then continuing on, being active has other mental and physical benefits, both immediate and long lasting positive effects on emotional states. It can help lower stress, anxiety, depression, improve sense of well being, and improve sleep quality. And so, with that, improving sense of well being, again, being more confident, feeling better with yourself, lowering your stress, feeling less anxious is all super important for our mental health. And when it comes to aging and physical activity, it's important to know regular physical activity can delay the usual decline that happens with aging. Building muscles and endurance and working on balance will help prevent falls. Being active boosts the brain by improving cognition, also known as our thinking ability and memory. Staying active lowers your risk of getting certain cancers as well. Adding resistance exercises can also promote stronger bone health. So, ask yourself this question: what do you usually do to add movement to your daily routine? Is there anything you can add at home as well? Increasing physical activity. Any physical activity is better than none. Physical activity burns calories even if it's not part of the structured physical activity plan or workout. Even if someone is inactive, health can be improved by moving just a little bit more. Examples of lifestyle activities also include chores, yard work, or gardening. Playing with your children or pets, and adding extra daily steps in can all help improve lifestyle activities. Some of these also include parking further away from the buildings that you work at or the grocery store, taking the stairs instead of the elevator, and standing up and pacing when you're on the phone. We know a lot of people already do this, and that's a great way to continue some physical activity while also doing something else. And so, what's a structured activity plan? It includes choosing an activity that can be performed at a moderate intensity level on most days and for a set amount of time. It also includes specific types of activities, which all are beneficial in their own way. So, two main types can affect how the body uses glucose. We have aerobic and resistance. We also have two more, which include the third critical activity, known as flexibility, increasing joint range of motion, and the fourth activity is balance to help prevent falls in older age. What is aerobic activity? It involves moving the large muscles over and over, increasing the body's use of oxygen. The heart beats faster to be able to supply adequate blood flow and oxygen to our working muscles. This is done continuously and not as a stop or start activity. An example of a start or stop activity would be repetitions of weightlifting. Um, and aerobic is especially helpful for managing blood sugar and benefits the heart and circulatory as we get our blood moving through our bodies and pumping. Can you think of some activities that help your heart pumping? Go ahead and take a minute and think about these at home. Some of these examples of aerobic activity look like brisk walking, jogging or running, cycling, using machines like treadmills, ellipticals, rowers, and stair climbers, swimming and aquatic exercises, and dancing is always a super fun thing that we can include. It's also important to consult with a provider to make sure it is safe to participate in aerobic activities. Some with heart disease, since it can raise your blood pressure or cause the heart to work harder, will need to consult with their doctors. Resistance activity. Strengthen muscles, potentially increase muscle mass, and promote retention of muscle mass as you age is an importance for resistance activities. It helps the body use insulin better, either from the pancreas or through injections that some people are prescribed. It is possible to do resistance training using a variety of equipment for resistance, like free weights, dumbbells, barbells, kettlebells, or household items. Resistance and body weight, such as squats, wall push ups, and heel raises. Can you think of any resistance exercises that you may do or would like to do? Some example of resistance activities include bicep curls, tricep curls, fly curls, lunges, planks, and abdominal curls, also known as crunches. Again, please remember to consult with a doctor if you have heart, eye, or kidney disease or any other health conditions to check to make sure that it is safe for you to participate. Flexibility and stretching exercises. Stretching can increase flexibility, muscle coordination, and should be done by all ages. Stretching regularly can help keep people on their feet better. Stretching is a good place to start for someone who has not been active in some time. It can be done as a part of a warm up and a cool down. When stretching slowly, reach as far as the muscle will comfortably allow and hold the stretch for 10 to 30 seconds. Make sure to not bounce or jerk your muscles as you can cause yourself injuries. Balance exercises. As we get older, it is important to include these exercises as they help maintain or improve balance to further lower the risk of falling. Many older people are at higher risk of falling and can lead to various things too. So, improving balance can be as easy as practicing standing on one leg at a time for as long as you possibly can. A good goal might be get up to around like 60 seconds at a time, and try and practice this several times a day. Be sure to do it on each leg so that you can get a good balance on both. So, some tips for preparing for physical activity. Aerobic and resistance activity should start with a warm up and end with a cool down. Warm up aerobic activities, such as walking, this is done at a slower pace for around 5 to 10 minutes, and then after the 10-minute mark, you'll usually pick up this pace. It's important because it helps prevent injury to muscles and improves blood flow to the heart. Cool down after aerobic activity ends. Again, you need to slow down that pace for about 5 to 10 minutes. It's important because the blood that has pooled in your extremities, such as your arms, legs, fingers, can move back to the general circulation and limit stiffness or soreness. And so, continuing on, again, stretching at least 10 minutes of stretching after the initial warm up or cool down is important because muscles are warmer and the joints are more flexible during this time. And so, stretching while muscles are warm helps increase mobility around joints and keeps them more limber, making you more flexible and more mobile too. And so, how much physical activity do you think you need for good health? Go ahead and take a moment and think about that. Have you heard about what is a good time limit throughout the week? How many minutes you should do? And go ahead and think about that. And so, frequency, intensity, duration of aerobic activities. There are national guidelines for healthy adults recommend a total of 150 minutes to 300 minutes per week of moderate aerobic activity. When it's more vigorous, it's around 75 to 150 minutes a week. But if you're doing both, go ahead and mix that time up too. Activity should be spread throughout the week. 30 minutes for 5 days per week is typically what's recommended. Structured exercise training of more than 150 minutes per week can lead to greater declines in overall blood glucose levels as well. But it's important to note doing any amount can be beneficial. What is a progressive increase? It is the best to start where you are comfortable. So start with 5 to 10 minutes of activity and work up to 30 or more minutes at a time. This is referred to as progressive increase in activity. Increasing a duration of aerobic exercise slowly lowers chances of getting sore, injured, or discouraged as well. So remember that it may take a few weeks to progress to exercising longer and feeling good while doing it. Ask yourself, which do you think is better? 30 minutes of nonstop activity or 3 to 10-minute sessions? Go ahead and take a moment. And so, with progressive increase, breaking up how long activities last in whatever way that works best for you is going to work. So, when managing blood glucose, doing 3 to 10-minute sessions is just as effective as doing a 30-minute all at once session. And so the goal is to get it done at some point throughout the day. And so you can go ahead and break it up as needed. Again, just trying to get that exercise in throughout the day is very important. And so, again, repetitions are known as reps. Each resistance exercise equals the number of times a weight or a resistance is lifted. And so that's a rep. And so lifting a weight 10 times is equal to 10 reps. A set is a number of times the reps are done. And so 10 reps is equal to 2 sets of 10 reps. 10 reps twice, sorry. Frequency, all adults should engage in at least 2 to 3 consecutive days of resistance or weight training activities. Again, intensity. You want to choose a couple of different exercises that cover all major muscle groups in the upper body, your lower body, and core. Try different weights until you find one you can lift for 8 to 15 times, but no more or less. This is going to be the right weight for building muscles, strength, endurance, and the muscle mass. So finding that weight is very important. Your body weight can also be used for training, like planks and lunges when incorporating these activities into your lifestyle. Again, it's important to note that when doing these things, we need to look at our duration and our rest. So we need to let our muscles get ready for the next set by resting for about 15 seconds to 1 minute. We can also note that sometimes we see different bodybuilders or people in the gym will go ahead and do some repetitions and sit on their phone for a couple of minutes and then start again. So it's important to take a rest. And we have to allow at least 48 hours between exercises done on the same muscle groups to give time for full recovery. So that's important to note too when we're doing these exercises. If you don't have any hand weights or resistance bands at home, is there anything that you use, or take a second to think what can you use? So some easy options. If you have no hand weights available, look like an unopened can of soup, or even a full water bottle, using a plastic jug with a handle, partially fill it with water, sand, or dirt, another substance of your choice. Again, exercise that uses a person's own body weight as resistance can be just as great too. And so, tips for proper lifting of weights can look like keeping the spine in correct alignment. Don't arch or hunch over, again, preventing injuring yourself. Lift the weight slowly with controlled movement, 2 to 3 counts. Breathe out when lifting the weight. Lower the weight slowly, 2 to 3 counts, and breathe in when lowering the weight. Avoid holding your breath during these exercises. Again, we need the oxygen flowing into our brains so that we can work out our body. And so, physical activity and safety issues. When it's important to have medical clearance, again, consult with your provider, make sure it's safe. Drink lots of water before, during, and after physical activity. It's important to be foot safety, wear your proper footwear, comfortable tennis shoes with socks. If you need to, some people like to have medical identifications. So people with diabetes can carry medical ID in case of emergency, to let people know what to do to help you. And so preventing low and high blood sugars, again, balancing food, physical activity, as well as medication will help balance those sugars and keep them at where you'd like. Physical activity and safety issues. Again, physical activity and monitoring you're checking your blood sugar before and after can help you learn the effects of being active. So again, like maybe get a log, write those down, bring them to the doctor, show them. Maybe there might be some recommendations they have. Again, physical activity and insulin, consult with your provider, see if there's any adjustments that might need to be made. And so we're getting here towards the end of our slides. And so here's that next slide. Sorry, I forgot to hit next. But yeah, again, thinking about the insulin, talking with your doctor. And so we also have some services that I'd like to go over. Again, we have a wellness center at our NACA facility. These are our business hours. We offer open gym access, free use of the space, gym equipment with, if you're referred as a patient, you're also community members, have cheap access to our gym, group fitness access to our fun classes, and we have some personal training, again, with a referral, or that can be paid for too. But thank you for watching our video. Again, was Living Well with Diabetes. If you have any questions, please contact me. All right. You have a great day. Thank you for watching.